Good morning, everyone. This is Dr. Katie Woodley, the natural pet doctor. This is Coffee Talk with the Doc, and today we're going deep into kidneys and the urinary tract system with our pets. Diet. Diet is the foundation for health. And this is where I go on my rant and get all excited because I love nutrition. And it's so important. What do we feed most cats? Like, I have goosebumps because I'm like, we can do so much with food. And the thing with diet, especially cats, we feed them kibble. We feed them dry food. What does that do? It dehydrates your pet. So when we're giving our cats kibble, we are actually making it worse. We're making it more likely that they're going to develop kidney disease later on because it keeps the body in dehydrated state. Cats suck at drinking water. They're not like dogs. That's just a fact. And so if we can get more moisture into their body from the very beginning, whenever that is, whether you adopt a senior cat like we did, and get them transitioned onto a wet food, or you have a kitten, start them with wet food. Just can the dry food, get rid of it. And with dogs, so we can use canned food. A lot of dogs are on dry kibble, and there is a point where, yes, budget comes into play. What's easiest? Those types of things do matter. And there are decent dry kibble foods. So that's okay if you have to do that. But what types of organic, real human foods can you be adding? The number one thing you're going to hear if your pet has kidney disease and you take them into the vet, they're going to say, get them on a low protein diet. And I don't agree. There's studies that show that it actually can make it worse, especially in the earlier stages of kidney disease, typically when we're diagnosing this. So we need to get these pets onto an appropriate, biologically appropriate. So remember, like feeding them real food that they can absorb, which is bioavailable. The body absorbs those nutrients as soon as possible. That's really, really important for these pets. And so freeze-dried raw food. Yes, freeze-dried raw food, definitely. So that is that is a good option. Someone just asked about that. And so there's different levels. Like, you do not have to do a home-cooked diet. Like, especially for cats, canned food is going to be better than feeding dry food. There's a spectrum, and some pets do better on raw diets. Now, we want to be careful with the amount of protein. Even if it is really good for them, we need to be careful with how much protein does go in, so we can use lower amounts of high quality bioavailable proteins. So that's key, is if we're feeding, a dry food and they're not absorbing it, we're putting more pressure on those kidneys, and we're also dehydrating them in the process. So that's really important to think about. We also, phosphorus. Phosphorus is so important. This is so much more important than like feeding a low protein. As long as the protein is appropriate and it's a high grade, good quality, phosphorus needs to be lower in that diet. Because when we feed foods that are higher in phosphorus, so this is where a lot of people will look at like the ash content, that's the mineral content in a lot of these processed foods. If phosphorus is high, we are going to escalate the kidney disease and move it a lot faster. So we need to be looking at that. We also need to mention the potassium supplementation. So there's a product called Azadil, and it's a probiotic that also has potassium in it that we use a lot for cats. So that's a great supplement to ask your vet about if your cat's not on it. And making sure they're drinking water. Get a water filter. Encourage drinking. If you are feeding kibble and you have to feed kibble, put water in it. Add water to the diet. Get your pet drinking more. It's really important. Now, supplements. So there are certain supplements, and this is where I love this. So supplements, herbs. What plants can we use that are going to help revive those nephrons? So a really common herb that I use a lot, and this depends on the individual pet. Remember, when I talk about herbal medicine, supplements, even diet, this is individual based. So this is something where you need to work with your vet, find a holistic vet or an integrative vet if you're like, I don't want to feed that prescription dry food. Like, that's not okay. So find someone that you can partner with that is going to look at your pet and go, okay, where are these imbalances? What do we need to support? How do we fix this? And Remania is one of the herbs that I use a lot, especially with my chronic kidney patients for cats. And Remania, what it does is it's this herb and it increases blood flow to the kidneys. And it can actually help revive these kidneys, these functional units, the nephrons. And what we see is the values go down. They're not supposed to happen. And you can reverse the stages of kidney disease. We've done it numerous times with using the right herbs and the right supplements and getting that pet on the right food. And so VetriScience, I love VetriScience. They're a great company, been around a long time. They have a product called Renal Essentials. So this isn't for like, if you're worried about your pet developing kidney disease and they're fine, I don't recommend just putting them on these things. Ask your vet about it, get the blood test done, get them checked out routinely. And if they start developing these issues, make sure you're working with your vet to ask them if this is worth doing. The other cool thing with Remania that I like is that there's actual studies that showcase how it acts to help reduce blood pressure. So we can use these herbs. They actually work better than some of the blood pressure medications we use in pets. So we can use these to work alongside those conventional drugs, potentially get your pets off the drugs if we can, not always, but we can use them so we don't have to use as much of the drug. That's why I love integrating holistic herbal medicine into our conventional treatment plans, because we can get so much better results. So herbal medicine, hands down. So let me sum up briefly. I went a little bit longer. We're going to go a little longer today, so just stay tuned. But let me sum up kidney disease. So we talked about the functions of the kidney. So filtering toxins, reabsorbing proteins. It's very important for hormone production to help with the adrenal glands. It plays a part in calcium metabolism. Vitamin D, so very, very important to the body. It can happen with chronic kidney disease, chronic renal failure, chronic renal disease, all the same thing. Happens gradually, can happen from congenital issues to chronic bacterial infections to high blood pressure to cancer. So there's a lot of different causes. There are breeds that are predisposed to this, so rewind and make sure you guys watch the replay once we post it. Clinical signs to watch for: decreased appetite, vomiting, lots of drinking, lots of peeing, more lethargic. Getting the blood work done, CBC, biochemistry, SDMAs, doing the urinalysis every single year for your pet, getting them in, getting it done so we can track trends to see if something's developing, and then treating. So preventative, getting them on the right diet now. There's plenty of blog posts I have, how to analyze your pet's food. You could go to our pet membership and see our webinars that we've done in the past that talk about diet and how to optimize your diet. So there's a lot happening here that you can do yourself as a pet parent to help your pet.